Hey guys, welcome back. Anglaisefolle here, and we're back for some more Project Hospital. Last episode, well, we didn't do much, did we? We put in a canteen, and oh god, that wall is not good. Yeah, we put in a canteen, and we didn't do much else really, did we? We just kind of let it go. We tried to make some money. I am going to do this wall. It's annoying me. It's annoying me. It was as we spoke. I was going to try and do it. Where are we there? But I can't do two things at once, apparently. I do need to go all the way along there, don't I? There we go. That's probably a bit of a waste, but you know what? I'm happier. That looks a bit better. So today, plan is to put in a bit of hospitalisation here, possibly shuffle this around so we get an extra clinic room, and then put in some oncology so we've got our last apartment in. So yeah, busy day. We have a fair bit of money. I haven't let it run along much. I did 1-2 days maybe. But yeah, we can kind of nearly break even-ish. I don't think today we'll break even, but hey-ho. We're coming towards the end. We'll leave it. We're not really that fussed, right? Yeah. Anyways, we'll pause it there. We will have a look in here. We want to sort out... excuse me. We want to sort out this department here. So where are we? Sexual health. That's the one. Right, we haven't got anything happening in here at the moment. So what we'll do, we'll remove that. Yes, they've lost their workplace. Yep. We will sort it out. Don't you worry. We do need her to get up. There we go. There we go. That's better. Right. So we can shuffle this down. I was having a look. We've got the space to do this, hopefully. She says. We need to leave 5 there, don't we? So let's rotate you over there. Come over here. Grab you. You know what? Oh, that's ridiculous. I wanted her to be by the window. Let's do a bit of the old plonk like that. Plonk like that. That's a bit better. Yeah. That looks nicer. Put your sample storage there. We'll put your thing there. That there. And I didn't pick up the bin, did I? No. Oh, it's the hand sanitizer stuff I picked up. Okay, can we... Oop. That 1, 2, 3, 4, 5. So yeah, we've got room... There. Doink. Perfect. Excellent. That's what we wanted. So, if we now grab ourselves this here wall there, scoot you over like that, it will make sense. It will make sense. And then we plonk in a door right. Well, that I don't want to do. I want it to open like that way. This is silly. Open. Oh, actually. There we go. We'll go that way. Because what we need to do is remove that wall, isn't it? Yeah. There we go. Phew. Got there in the end. So if we add that. There we go. Nice. Sort the flooring out. Plonk that like that. There we go. Come in here. Where's the lab? Give me the lab. There we go. We'll add that in like that. There we go. Nice. Oh yeah, did I not? I didn't ever sort out the corridor. I thought I had. Clearly not. It was possibly in one of the ones where I was running it offline for ages trying to sort it out that I then did it and then then completely forgot to actually then do it when I've redone a level because I've redone it so many times. I've tried to make money. Tried to do this. It's just not working. What do I want to do? I want to do this. I want to do that. And then I want to rotate it into there. There we go. Excellent. That's sorted. So yeah, if we grab an extra member of staff for in here. What do we need? Who are you? You are diagnostic genius. What else? Diagnostic genius and practical diagnosis. I mean, yes, Christine McTaggart, you are coming in. Yeah, we want Jennifer in, and then we want Ron back. There we go. So yeah, so that's that sexual health bit sorted. We've got 3 clinic rooms, the lab back. Excellent. Right. Next up, we want to do them. Yeah, they really don't have much, do they? Observation room, nurse's station, on-call room. I mean, that is pretty marvellous, isn't it? Can we... I mean, I suppose we only even need 6? 12. Do we maybe do 12? Do we maybe do... Yeah, I think maybe we do 12. So hang you on. How about we do a bit of the old... No. That's not what I wanted. I wanted to do that. With that. Oh, look at plastic. Plastics. It's... Yeah. There's so few people. I mean, do we do it like that? That isn't going to be enough room for them, is it? Yeah, if we do it here, we could then put the nurse's station in the on-call room there. Yeah, there we go. Like I say, it may well be overkill, but I'm happy with it being overkill. And yeah, you know what? Doop, 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 doop. The walls. We'll grab a wall there, take you all the way along there. Perfect. There we go. Nice. Actually, we do need that wall, which we should take... Oh no, we'll leave that open. That could be the nurses, can't it? Do we leave that open? No, this could be the on-call room. There we go. So if we go like that there, shall we, enter here, then all this can be the nurses' station. So if we then remove that, perfect. That's right, right? That is right. That is right. It is right. I tell you, it's right. Come over here. So we want an on-call room right there. Observation room. How's about we go plonk like that. There we go. Missing. I have no idea what is missing. We'll figure it out in a second. The nurse's station can come. How's about all the way to there? There we go. And then we extend the corridor so I don't forget. Perfect. And then you know what we'll do? We'll just add in a white wall. Just along there. There we go. Nice. Right, flooring. Flooring, important stuff. We're on the white. Perfect. Excellent. Right, and then the nurses thing is what we've been doing. Was it this one we've been doing? Is that the same? Ooh, it's that one we're doing. Let's not overdo it, right? There we go. A bit of that. And then a bit of that. There we go. Nice. Oh, I did that wrong, didn't I? Why did I do that wrong? There we go. Nice, 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 nice. Doctor's office. I've got no idea what doctor's office what we've been doing with doctor's offices wall-wise. What I've been doing. Where are they? Here. There we go. Let me just get this nurse's station thingy done and I'll be back with you. Oh, well, we need a heck of a lot more in these observation rooms than we currently have. We've got the defib. But yeah, we need a lot more stuff. I was not expecting this. Okay, interesting. Let me just sort out these walls again over here, because that's not the right colour, is it? Yeah, that's all right. Good. Right, oh, back to here. Back to here. You know what? What we could do is scoot you over a little bit. And then make the nurse's station a slight scooch smaller. That's what we then do. We make the observation room too bigger like that. Sort out the flooring. Flooring, she says. Take that there like that. And then we'll put you down there like that. There we go. So now we can actually do some stuff in the observation room. So yeah, you need a rubbish bin. We'll put that there. You need a CRP scan. Okay, so how about we put in an equipment cabinet right there. With a CRP scan on top. You need a sink, which is fair. I'll plonk that over there. You need a mobile workstation. Wow, who knew? There we go. Chartboard. Yeah, that can go there. You know what? Defib. Gonna go there. Equipment. We need an audiometer. Okay. Here we go. Bear with. Bear with. We'll put another equipment cabinet there with an audiometer. I mean, that was a lot more than I was expecting to have to put in there. But you know what? That's all good. How is... Yes, so that's happy. So what is wrong with these? What do you need? What are you missing? Life monitor. Oh, they've all got life monitor. Oh, good grief. Okay. A life monitor advanced? No, life monitor wall. Let's go for the life monitor on the wall, shall we? Bit different. There we go. Looks a bit more modern, right? Here we go. Yeah, you guys have got the other one. Yeah, you guys have got... Which one have you got? You've got just the normal life monitor. Yeah, no. That is that department done. I like... Oh, no, no, no. Not quite done. We need some staff. I'm hoping one on each shift should be enough, right? Surely. Oh, you're nice. Anthony Burgess. Yes, come on in. Patient cares. I mean, no, you're just rubbish. You're just rubbish. You're not so bad. And then how's about someone over here? What have we got? You're not the best, but you know what? You've got rest assistance and diagnostic genius. Yes, we'll take you. And have we got anyone else? I mean... Ooh, I'm glad I didn't get you. You're depressed. You're pretty cool. We'll go with you. There we go. So we've got sexual health opened up overnight. That's rather marvellous. It's really annoying because I've just sent someone home saying, we don't have an overnight facility. We currently do. Oh well. Tis what it is. Tis what it is. Oncology. Oncology is the next big thing. I mean, do we need to... I think we need to finish off Thingy first, don't we? Urology, nephrology, this, isn't it? Yeah, I mean, do we... Because we've only got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We've only got 10 beds. Which isn't particularly mass amounts, is it? I'm thinking, do we put in another... Do we put in another bit of ward here? I mean... It could be helpful, right? Could be helpful for the people. How wide... Let's have a quick look. How wide is this? That is 7 wide. What have we got here? We've got 9. I was thinking we put something like that there. That just seems a bit weird. We could... That's just a weird little corridor there, isn't it? They've got... I think, yeah, they've got plenty of toilets. They've got the visitors' room. I mean, where do I put some more there? Because this is just ridiculous, isn't it? This is just a mess. And someone's reading their little book there, though. That's pretty cool. How much have we spent so far on building? 76k. Holy moly! How have I spent that much on building? How? Oh god, you could see how many people were collapsing whilst I was trying to get myself ready to start recording. Jesus. Yes. Yes. We're just gonna press pause again because we don't want collapsy folk. Oncology, what do we need? Oncology waiting room. Same old, same old. Diagnostic unit, cardiography, sonography. And an operating room which we could put downstairs. HDU regular wards. I mean, we should be able to manage simply, right? We should. We should, and we should have plenty of room over here. We should have loads of room. Why do we not have a wall there? Oh, that's why. That's fine. Thought that was a little bit weird. Right. Let's put a door into there. So that's the entrance. I mean, do we do like oncology here? Like the main rooms? Are they going to need labs? They're going to need labs, aren't we, babe? So do we put another load of labs here? That could be interesting. And then put towards... We've got too much room. We've got so much room. I haven't said that in a while, have I? Oh god. Okay, right. Let's make a start here. Oncology room needs to be 4 by 4. So how... Actually, hang about. Let's do reception. So literally reception as you come in. A 4... No, what is this? That is there. So a 4 by 5 like that, yeah. Then we can do a waiting room. All the way along there like so. Oncology office. How's about we do 5 by 5. 5 by 5. Yeah, I like that. think I like that. I don't mind that. Let's put it that way. Then we'll do a restroom. We need a large restroom, I want to say. We're going to need like 2 diagnostic units, aren't we? Yeah, we'll go with that. Toilets. And then they can access it, and then the wards can access it. We'll go for... Where's the cleaning closet? We'll go for a little teeny tiny cleaning closet there. We'll extend the waiting room just a slight scooch. I want to say the diagnostic unit is where... examination and treatment procedures for hospitalised patients. Okay. So that's people in and outside of... Yeah, okay. Okay, so these 2 need to be accessed by these guys as well. So what do you... Sonography, what do you need to be? 5x4. What we got there? 4. I don't know, how about we do a little corridor there? 5x5. Cardiography, what do you need to be? 5x4, so we'll do another 5x5. There we go, and then we've got a corridor through there. That's not bad. That is not bad. I'm not minding that so much. A lounge. How's about we... Can't do a lounge there, can we? I mean, that could work. Could be a lounge, and then we're still leaving ourselves room for some labs up here, should we want to. Yeah. I'm not minding that. I'm not minding that. Regular ward, we need to have it as a 12 by 10. Okay. 10. 12 by 10. HDU. 12 by 10. There we go. Nice. Very, very nice. We've got a little bit of room there. What do you need to be? 4 by 3. I mean, we could do a whole nurses station like that. Nice and open for them. I mean, that's not so bad. And then an on-call room. Eh? I mean, that's just ridiculously, we've got so much room. We've left ourselves so much room. Why have I been squishing everything together? I have no idea. I just feel like I have been completely and utterly squished in all the other rooms. Look, oncology is going to have a massive room. Massive break room. Like that. There we go. And then over here, I've got no idea what could be over here. I mean, that could be the extension of this. Ooh, I was going to say, do we do a helipad over here? Oh, no, you know what? We're going to do a big old outside garden over here. We'll fill this up a bit. But yeah, then an outdoor gap. Yes, that's what we'll do. Right, let me fill all these in and get it all built up. Right, so I've got everything more or less kitted out apart from the GP office or the oncology offices. Oh no, I tell you what, I forgot the bleeding diagnostics units, didn't I? Oh yes. Oh, foolishness of me. Foolishness. Oh wow. How did I manage to forget them? How about we do a 5x4 there and a 5x4 there? Oh, that's ridiculous. That's stupid. That's stupid. Oh no. Right, I think we're gonna have to go along here, aren't we? Oh man, how did I forget that? I forgot I'd put the lounge here, hadn't I? And I thought that's just giving us a one corridor. So I put the lounge here, coffee room here, but yeah, we need the diagnostic rooms, don't we? Oh, that's kind of messed up my plan of having a big old outdoorsy area here, hasn't it? Unless if we come in here and I was going to say scoot this one around to here, but then the toilet's there. Oh, you know what we're going to do? We are going to do. Move a selected room or area. Yoink. Move you to there, unless we move you all the way down to here. Let's move you down to there. There we go. And we'll sort out the walls here. Get that going down like that. There we go. Nice. get the flooring going down. No, 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 no. What? There we go. No. There. Get that sorted. Oh, we need to remove that wall, don't we? That would be a handy one. Remove that wall. Yes, right. How's about we remove some of these walls as well, because that's just getting in the way. We could technically go for a wall like that. I mean, what's the point? Because we could add a couple more toilets in here. We've just got a room going to nowhere. That's what we've got. We've got a nowhere room. Yeah, that's bizarre, isn't it? I mean, oh, pants to it. Pants. We'll remove that door and just leave that little space there. Because I just want the weirdity, right? Just want the weird. And then if we... What have I done? No. There we go. Remove that. Actually get that right and get the whole room. Please and thank you. How about we move you down to here? And you get to have like an extra little corner here. That has got that, hasn't it? Yeah, so if we then do on-call room and bring you out like that. Oh, this is all going drastically wrong, isn't it? Oh, the best laid plans. I'd like to say I'd completely missed that little fact that... where am I? What am I doing? There, that one. Yeah, I'd missed the little fact that, yes, we needed diagnostic things, didn't we? Ah. Foolishness. What? We're just doing a patchwork colour now. Oh, God. Right, there we go. So that's that. That's these guys here. So we could do a couple of diagnostic rooms here, in essence, couldn't we? Diagnostic unit. So what did you need to be? 4x4. So how's about we do it? Oh no, that's a corridor there, isn't it? Okay. Oh good God, I'm so bleeding confused. Let's remove that. Get a 3 wide corridor down there. This thing doesn't need to be all the way down here, does it now? Of course not. Oh, good. No. Get that right. So a 5x5 and a 5x5. Yeah, okay, then we've got a door out there. Okay, that I can kind of cope with. That I can kind of go with in the grand scheme of things. Let's get you. Oh man. How have I gone so drastically wrong here, right? Oh, you've got to love it. You've got to love these things that are so well planned out. That's the... No. I want that colour wall to go all the way along there like so. Okay, that's not what I was after, but you know what? It's going to work. We've got a little random... You know what? We're going to remove that wall. No, remove that wall. There's just a little hole in the corridor. I mean, oh, how silly is this? How silly is this big long corridor? I mean, oncology's got a heck of a corridor. Oh no. This is me trying to do too much at once. There we go. Nice. For Pete's sake. Bloody Pete, I tell you. Right, there we go. I think now we're at the point where we can actually do what we want to do, right? Oh man. Okay. So let's get these offices kitted out. So what do we need? We need the whole bed, exam table. Good God, this is going to be tight. Okay, so if we go like that, we'll get the medical light up above, as expected. Eye test. You can't go there, but you can go there. Excellent, perfect. We'll get the hand sanitizer and the bin. We'll get the office desk right there. PC, you know what? You can have a little printer. Your desk chair. Boop-a-doo. What else do we need? Audiometer, CRP scan. So if we go for, as I found out, get the 2 little equipment things. We can get the audiometer and the CRP scan right there like that. Look at that. Perfect. We'll get a little fancy chair there so that they can sit chatting to the doctor. Excellent. There we go. We've still got 49,000. We should be able to do this. We should, she says. All hopeful. Right. USG. What do we need? Do we need a desk? We need a desk with a PC. Okay. We can do this, maybe? At a push. If we go around this way. Yeah. Do we need... Yes. So we need to go there. Right, you need the USG attached here, like so. Let's get, where are we? Disinfectant, dispenser, biohazard bin. What else do you need? You need a medical light, don't you? Are you then good? No, what else do you need? What else do you need? I don't know what you need. Let me put in the desk first. Let's get that sorted. With the PC, the printer, and the office chair. There we go. Right, what else do we need? Equipment cabinets. You know what? You're going to have to be rotated like that. Ah! Where is it? Control. No, shift. No, you know what? Just go there. Get out of the way. There we go. Pick you up, put you there. Right. What do we need in here? Elastograph. Where do you go? There. That's not right, is it? You need to shuffle up one. You need to shuffle up one. You can... No, you can go anywhere. There we go. Shockwave therapy. What are you missing? USG. Well, you got the USG. Yeah, how is that not happy? What is it saying it needs? Does it need the shockwave therapy at the bottom here? Equipment cabinet? Equipment table even? Yes, there we go. And then the shockwave therapy. Yes, we get there in the end. We get there. We're a little bit squished on room though. Can we... they can't... Oh, would a wall-mounted one work? We did a wall-mounted one. Okay, up there. Oh, that works. Oh man, that is ugly. That is an ugly ass room. Not good. But you know what? It will work. Right, and then same again in here, I guess. No, you need less, don't you? How about we do you there? You need an equipment table there with the ECG. Yeah. Right, medical lamp up above. Office desk. Plonk. PC. Yes. Printer. Right there. Chair. Where's the other chair? Give me the other chair like that. Excellent. And then we get our little equipment cabinets. Plonk. Ooh, disinfectants. You know what? You can go that way. What is that I see? A lab analyzer. Can you go there? Wow. Okay. We'll go with that, right? Oh Christ. Okay, so that's that. That doesn't look sturdy enough to hold that, does it? You know what? I'm gonna have to do the whole equipment table and lab analyzer there. And you know what? You are going to be sold because you just look out of place there. You look too small. We'll go for a big one. There we go. Okay, so that's them done. How much money do we have? 30,000. Okay, we'll get the diagnostic unit sorted. This does not need a desk, which is fab. We're going to plonk you right there. Medical light right above. Disinfectants. You know what? You can go up here with the bin underneath you. Equipment cabinets can go... Oh god, I've done that the wrong way, haven't I? Like that, like that, like that. In there. Equipment cabinet, no. Equipment cabinet there. Audiometer. CRP scan. Mobile workstation. How about over here? Plonk. Eye test. Yes, thank you. A chart board. Over there. Stretcher. I mean, you don't particularly need a stretcher in here. You'll be fine. You know what? You can have one outside the door and that one can have one outside that door. We have got oncology ready to go apart from staff. So let's get ourselves a load of staff in, shall we? What is this? This is USG. I mean, you look pretty good. I wasn't paying attention. You look not bad. Night owl. Okay. We've got a good old night owl right there. Cardiology. Yeah, you can come on in. Nice. Janitors. You're not bad. You're pretty cool. What's this? Oh, these are our oncology officers, aren't they? Oh yeah, we need a good boss somewhere. You know what? You are pleasant and loyal. You can come in. Oh. That just opened oncology, didn't it? Here we go. Good boss. Okay, so actually, you're gonna go. Oh no, you're a workaholic. You're a good boss. There we go. And then we'll plonk you, Pete Bonner, as the boss. And then, you know what? You can come in on night shift. We'll get a little receptionist here. Ooh. You there? Good. And then we need to get some nurses. Hey, you're a night owl. Medical surgery. Okay. Oh, we'll get another one with medical surgery there. You're not great, but you shall do. Did that work? It did not. Right, we're clearly going medical surgery first. Oh, you are not bad. Nope, we'll get some new ones. You are decent enough. Right, okay, so we've got them. So we'll now get some specialist nurses. Okay, so you want to be on a night shift. You can come in on a night shift. You want to be on an early shift? You? I don't know, but you are now. We've got 3 out of 3, 3 out of 3. Perfect. Technically, we can open. And then down here, we need some surgeons, don't we? So if we grab a surgeon, let's have a quick gander at all of you. I mean, yeah, you're going to be all right. You there? Depressed. You know what? Yep, you're fine. So we've got one surgeon. We need a tethonist, an anaesthetist even. You there? And an anaesthetist. What's that? That's depressed, isn't it? Yeah. What's that? Hungry. Yeah, we can cope with hungry. We've got an anaesthetist. Perfect. And then we just need... You know what? We'll go for another surgeon. We'll re-roll. Oh, God. 15,000. Ooh. Yes, you. Oop. Yeah, that was it. Thinking, going, yeah, we can open. Because we can open. What are you? You... Germaphobe. You know what? Yeah, you're coming in. Then we just want a normal doctor. You know what? We'll get one who can do... Yeah, diagnostic genius. Have a look at all of you. You're stupid. Or slow or whatever it was. I can't remember. What is that? Unpleasant. Yeah, no. What are you? Slow and could be late. I mean, that's not particularly great, is it? But yeah, I think we are good to go on the oncology. How is that looking? I mean, that's not looking too bad, is it? It's looking all right. It's looking all right. And we do have enough space here for a rooftop terracey place, something or other for the people. And again, we could put some more labs in up here. So yeah, let's yellow fever. Yay, great. Have all the stuff and the things. There you go. I mean, we're down to no money. We're down to absolutely no money yet again. Look at them all. They're all on break. Well done, you guys. Oh, patient died. Oh, have an autopsy. But yeah, it's not looking so bad up here. They're collapsing. You will collapse. There will be a lot of collapses. This place is relatively busy. All sexual health up here. Have we got anyone on the ward? We do not. Of course we don't. It's hard to find people to go up on the ward. Oh, it's lunchtime. Complicated diagnosis. Okay. I mean, have a urine analysis. That kind of makes sense if you've got painful urination and abdo pain. Feel their abdo and take the temperature. I don't know why you're having a urine test, but that's fine. Yeah, collapsing. There we go, nice. Yeah, clearly lunchtime. And I do think that putting a canteen up here has really helped. Patient, yes. I think it's really helped having the new canteen up here, because not all the staff have to go all the way down to the bottom. And again, why would you want to go down here when it's absolutely chucking it down? You can get to see the lovely flowers in the rain. Yay. Why do we have blood over here? Where are our domestics? Come on, domestics. Sort it out. Oh, you. Get over here. Come on. Yeah, collapsing. I'm not really paying any attention. Oh, Dr. Foll. How is Dr. Foll doing anyway? Dr. Foll ain't bad. 100% general medicine, 100% acute medicine. You're not doing bad, Dr. Foll. I like. You there. Get over. Get to cleaning over here. Ah. Clearly not. But yeah, autopsy finished. Yay, great. Go home. Again, we got to like 3 out of 9 days. It's just, yeah, it's just not happening. Ooh. We have a patient. You there. Nicola Tig. Okay, swollen lymph nodes and fatigue. Physical exam. What's that going to give us? Nothing. Speech listening. Yeah, whatever. We need to... Where are we? Favourite. Yeah, we want to favourite this patient. We don't want to control, but... No, we don't want to... Yeah. Default. Favourite patient. Yeah. We let them do the testing, but we want to know what happens to her. Oh, wait, have a neck palpation. She's got swollen lymph nodes. Do a neck palpation. Okay, that gave nothing. Okay, CRP. There we go. It's not going to show anything. You need a blood test, really, don't you? A CA... Where are we? A CA blood sampling. But again, that seems a bit excessive straight away. But, although a breast exam, that seems a bit excessive also. Yes. How are you doing? Oh, you're doing nasal cavity inspection now. Okay. Fair, we'll let you have this. Oh, he's the head, isn't he? Head of the department. Blood pressure. Okay. And we... Zoop. There we go. Let's see what he's up to. Yeah, what's he doing now? Oral cavity inspection. Right. Now what are you doing? Haven't made this too efficient, have I? I really should have the disinfectant stuff right there, so then they can go dupe there, dupe there, dupe there. Right, so she's sent for an ECG. ECG. Gone straight in. He's gone straight in. Yep. Literally, we're just going to follow Nicola. Where's she gone now? Oh, is she going to the toilet? Are you? Yes, you are. Okay. That's fine. We'll let you off. Where are you going now? Filling needs. So are you going to go back to the doctor now? Please tell me you're going to go back to the doctor. Where are you, Nicola? There you go. Have a seat. There we go. Someone call her? Oh, where are all my doctors? The home time. Oh, she's got a fever. Okay. Where did they find that? Where they even found that out? Fine, right. Call her in. Nope, the other one's called her in. Right, Maureen. Now what? Oh, USG. USG? No. Where are you going? Go to doctor. Going to doctor. What? Where are you? Where are you, Nicola? Okay, you're over here. Are you going to X-ray? Where are you? Okay, so you've been called down here. Okay, so this is probably why... Yeah, stop doing that. This is probably why a lot of our time is being wasted, because they're not going to the one that's closest to them. Okay, now she's going back upstairs. Yeah, so much walking. No wonder I've had collapses all over the place, and we're not even saving any patients or anything. Oh, minus 62k. You know what we're going to have to do? Let's just take that loan so that we're in the positive for midnight. We don't want our rep going down. No, we don't like rep going down. Penetrating head trauma. You can be urgented. Nicola, where are you? Oh, you're here. You're back in here. Oh, he's seeing someone else. Who have we got? Ricardo Williamson. Oh, no. ALL. Oh. You want a CBC? You need a CBC and a bone marrow. There you go. That'll be the one. Oh, T cell, the ALL, not so bad. B cells. Any of the above aren't great. Yeah, the USG gave us nothing. You know what? Have a CBC. Oh, is that... Yeah, he's staying late. He's working late tonight. Peter, well done, Peter. Yeah, you haven't. Yeah, you having a bone marrow done already. You're collapsing. Is what it is. Is what it is. Let's follow Ricardo as well. Can't diagnose a patient. We'll send him to bleeding general surgery so they can have a gastroscopy. Have you had your bone marrow? You should not be walking after a bone marrow. Oh no, you haven't had the biopsy done yet. That's fine. We'll let you off. You there. BBC. Have a fish as well. Fish. Hey. Fluorescence in situ hybridization. Yes. Yeah, it basically attaches some probes to DNA sequences. I'm sure I've explained this in the past. I can't really remember. I don't really do it, but I don't ever do it. But yeah, it replicates that DNA and amplifies it and makes it shine up under fluorescence. Hence fluorescence in the name. But yeah, it's a pretty cool test. It is a pretty cool test. But yeah, otherwise, okay. Just get through all these. Where are our guys? You are having your... Oh. Please tell me that's not your blood. Well, that might be your blood if you've had your bone marrow done. Because you shouldn't be sat there, because that is... Oh, when I first started in the labs, they used to do sternum ones. I never actually went to a bone marrow... Oh, here we go. I never went to a bone marrow collection, but yeah, oof. Can you imagine? You're laying on a bleeding bed and someone's on top of you with a big old fat needle pushing that into your sternum. Yeesh. Now they do them mostly in hips or... No, it is the hip, isn't it? Because the older that you get, the less bone marrow, less of your bones have really active bone marrow. So it's just like the big bones, so like the hips and stuff like that, or your femurs and stuff. But yeah, not your small bones. You're not creating many cells from them. But anyways, Ricardo Williamson, high T cell count. What did we get that from? What was that from? That was the... Tell me please. Where do we find that? That's the blood smear. Bone marrow test. Ah, yes. So you do the blood smear. Okay, so that would be a blood count. Yes, that would be the blood count, won't it? CBC testing. How have we not found lymphocytosis yet? Huh. We should have found lymphocytosis from the CBC, because the CBC would then lead to the blood smear. Because you'd have abnormal test results on your complete blood count, or for FBC we called it. Yeah, you do the full blood count, you'd measure all the cells and stuff. From that, because it would look abnormal, you'd do a blood smear, to which then you'd then go, oh wow, and then you'd send it through to the haematologist, and the haematology would be like, yeah, let's do a bone marrow to actually figure out exactly what it is. Hence the T cell acute lymphocytic leukemia, to which you'd have it done on flow cytometry, to be fair. That one would be... Yeah, it'd be flow cytometry, because that looks at the markers on the cells on each different type of white cell. Sends them through this machine and it'll tell you what they are. But yeah, that is pretty cool. T-cell acute lymphocytic leukemia. Not bad, not bad. Yeah, see, that's saying fish. Yeah, see, why would you do fish? Philadelphia. No, not for ALL. No. The 9 and 22 swap, that is for CML. Anyways, septoplasty, you have not got a bed. Okay, well, go to HDU. Why don't you? Right, where are we? Where are our patients? You there. Have we found out what's wrong with you yet? No, we have not. Okay, you have got ALL. Yeah, ALL. There you go. Have some testing. I'm guessing, do you need to be hospitalised for that? Yes. We have some regular hospitalisation on that. Whoa. What did you have? Basal cell carcinoma. Just some imicomod. Ooh. Oh. Treat superficial basal cell carcinoma and acidic keratinocytitis. But clearly I know my words there. Right, you there. Have you gone for... Yes, you've gone... You're hospitalised. Okay, yeah. Good. Get yourself in bed. CBC testing. Nothing. Of course it's showing up nothing. Do the blood smear, do the flow cytometry. I don't want to do the fish blood draw PCR, but we'll find the hidden symptom. But yeah, this is where I know. Like, you give me the haematology, diseases, that's where I shine. I say shine. That sounds really horrible, doesn't it? But no, this is what I know. This is my job. It was my job. Now chemistry, but haematology. Yeah, I know haematology. You there? Sudden lymph nose fever, fatigue. Oh, that is her. For God's sake. For God's sake, I have no idea what's wrong with you. No idea. Well, you know, yeah, he just went, definitely. You know what? I think Nicola, we are not going to find out what's wrong with Nicola. I'm quite happy the fact that we managed to find an ALL. I'm happy with that. It's usually a kiddie one, actually, to be fair. So how old is he? 42. I mean, yeah, it can happen. It can happen. But yeah, you know what? What I think I'll do is I'll hold it here for today. We've finished off a department and built a whole new department. The whole new department doesn't look particularly great, but you know what? It's going to be perfect. It's going to work fine. It's going to give us some money. Maybe. Did it give us any money? Oncology. Minus 4,000. Great. Great, 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 great. We're going to do really well here. We lost... I can't even figure out how much money we lost yesterday. A lot, let's put it that way. But yeah, oh, BCL, oh, BCL6 3Q27 hypermutation, B-cell lymphoma. Well, damn. Okay, oh, that could be either follicular or diffuse large B-cell lymphoma. Okay, okay. Zinc. Sorry, I'm just having a quick read. Stat independent IL-4 responsive B cells. That's it again. I'm geeking out here. DLBCL. Yes, we see that quite a few times. Then does that mean it could be follicular? No. No. If you've got that, it's gonna be that one. B cell. It is. To which, what did you need for that? That would be. Chop therapy. So that's occur. It doesn't actually say there. What is it? Chop chemotherapy is. Ooh, it's 4 different types. It says chlorocalcine and I know. We'll keep an eye on it. We'll come back next time and we will keep an eye on Nicola and also whatever his name is. Ricardo. Nicola and Ricardo. We'll keep an eye on those guys next time when we come back. But I think next time what we need to do is we'll get some labs up here. We'll get a haematology lab up here. We'll get a rooftop terrace up here. Again, every hospital needs a rooftop terrace. I mean, plastics could get a rooftop terrace as well. Go to there. Have that. There we go. Yeah, I mean, another rooftop terrace there. That could be pretty cool. And then I think we need to extend up here. Why do we have windows up here? What have I done? Oh, God. Let's just ignore that. Get up here and get ourselves a helipad. Because I didn't put a helipad on the last hospital, did I? I was basing that on the hospital where I work. And our helipad is kind of miles out here. So yeah, I think, yeah, next time we finish off all the loose ends and little bits like that. Add in a helipad. And I think we will be golden. I think that'll be all we can get done with this hospital. But yeah, hopefully you have enjoyed. If you have, tap that like down below. Comment away. And if you haven't already, please do subscribe to the channel and come back next time where we finish off our hospital. Yeah, I'll hold it here and I'll catch you on the next one. Toodles, folks.